insufficient exercise or be balanced to that equation will increase your overall weight. So that is in fact a problem, but sugar-sweetened beverages and junk food only contribute to a portion of that. When you look at what has been proposed by a lot of folks in public health, they've recommended this concept of a penny an ounce tax. And what has been asked, what I think is a very interesting proposition, is that if you put a federal penny an ounce tax, it would raise an estimated $1.5 billion in its first year. And what was done in some of the what could be done in communities is to reinvest that money into broader-based treatment and prevention programming. So take the money that's generated from this taxation and invest it into programming. Because what has been demonstrated is that we don't have a smoking gun here. It's not sugar-sweetened beverages or any particular food that's causing obesity. It's a complex multifactorial problem, which will likely require a complex multifactorial solution. So it's a potential potential benefit that could be generated from considering something like taxation as a strategy to generate revenues to broaden the strategies that are used. So with that, I've used sugar-sweetened beverages as an illustration of one mechanism utilizing policy to address the issue of obesity, and I look forward to our next portion of the discussion. Thank you.
I'll go very quickly so that we have time for questions. As a general matter, I don't have a lot to disagree with there. I call myself a Pigouvian, which as a function of economics, Pigou was an economist who theorized that, look, the government is going to have to tax something, and when you tax things, you should tax things that have a negative effect rather than things that have a positive effect. So rather than taxing income and thus creating a disincentive to work, you should tax things, you should have sin taxes on cigarettes, on alcohol, and certainly sugared beverages can fit within that category. What I would be curious to see, though, there are countervailing effects here. Certainly, this won't be so much of an issue if the tax is imposed at a wholesale level rather than at a retail level. But, for example, obesity, while the gap is narrowing, is still higher among the poor who use food stamps, and at the moment the government is effectively subsidizing the purchase of sugared beverages because you can use the food stamps to purchase the sugared beverages. Mayor Bloomberg is petitioning the government to permit a 2-year experimental program that would prohibit the use of sugared beverages on food stamps. It would be very interesting to see whether that changes behavior, because that will triple the cost, effectively. Well, I mean, it will substantially increase the cost of sugared beverages from 0 to whatever they actually cost. But to the extent that we do tax this at the retail level and people can buy sugared beverages at food stamps, when you buy food with food stamps, you don't pay the taxes on it. So we have, again, sort of contradictory government policies that would prevent the ideal of this to take its full effect. The other thing I would like to see in terms of empirical research is we had some very interesting unintended consequences from another government policy a few years ago. The government required a substantial amount of gasoline to contain 10% ethanol. Ethanol is made from corn. That drove up the price of corn considerably, which in turn drove up the price of high fructose corn syrup considerably, which in turn increased the price of sugared beverages. And I don't know if you remember, but a few years ago, if you bought a 2-liter bottle of soda, you could probably get it for 99 cents in most places, and now it's hard to find it below $2. Whether the price has doubled or increased 30 or 40%, but the price has dramatically increased over the last few years, and it'd be interesting to see to what extent people have actually substituted away from it with this unintentional tax on high fructose corn syrup through the ethanol program. And that would be very interesting. I don't know whether the sugared sweetened beverages tax would apply to sports drinks.
Most of the ones that are sweetened beverages, sports drinks, soda,
Snapple.
is, yeah, all the
Okay, so that's less of an issue. One more point that I do want to emphasize, though, is that we have studies out there that show that really, you can talk about Atkins, you can talk about the dangers of high fructose corn syrup, but at the end of the day, it's really calories in versus calories out, and it's very unimportant what those calories are. And certainly, sugared soft drinks are empty calories, but by coincidence, there was a story on CNN.com today. A nutrition professor out of the Midwest was able to lose 27 pounds on a Twinkies and Doritos diet because he held himself to 1,800 calories a day, below his 2,600 calorie norm. And that 800 calorie deficit was enough to cause him to lose weight, even though a substantial portion of his diet was Twinkies, which is possibly the only thing less healthy than sugared soft drinks. Singling out individual foods without recognizing that what we have is a larger social problem where people are exercising less and eating more, regardless of the mix of it, I think we'll end up missing the crux of the problem. Thank you.
In fact, I agree with that statement that, as I mentioned, there's no real smoking gun here, and one of my favorite dietitians used to say everything in moderation, including moderation. And so I do think that one of the challenges that we have is that when we discuss food, food including beverages, that there isn't going to be a single causative agent that is going to be a contributor. And so that, although I don't recommend anyone trying out the Twinkies and Doritos diet, that seems like from a weight loss perspective it might work, from a nutritional maintenance perspective it's probably not the best plan. So, but I would like to underscore that while this is, at the end of the day, an equation of input and output, I think that what we often focus on is the fact that, well, it's just all of us as individuals that determine whether or not we weigh what we do, or our fitness or cardiovascular health. And I think one of the factors that this really discounts is the role that the environment plays. And I think that the environment that we're in has really been well characterized as an obesogenic environment. That is, lots of different factors in our environment that encourage us to consume and to not listen to any internal cues of society or society that we have to say maybe that's enough, but it's all of a message of more. More consumption, more purchase, more consumption, more purchase, and please don't get up and go exercise. So I think that that's something that we need to consider. And I will say that one of the reasons that we talk about the role of policy intervention, and one of the challenges of policy intervention is that we really do not have a good coherent strategy, and it's very difficult. Public health is an incredibly powerful agency to be able to dictate policy from a multi-level perspective. But what a lot of us in the research community are trying to do is to be able to test interventions that occur at multiple levels to evaluate whether or not things like taxation or other types of programming or changes in the physical environment that we're in, taking soda machines out of schools, other policy, changing the environment strategies used in combination may actually be a more important contributor to promoting healthy weight maintenance and promoting people engaging in positive health behavior change. So it's a really challenging problem. As I mentioned, it's a complex multifactorial problem. It will likely have a complex multifactorial solution. So I look forward to some of the questions and get some of the audience input on our discussion here. Thank you.
And with that, we'll open up to questions from the audience for our speakers. Yes?
In regard to the sweet beverage tax and all that, it's something I wonder about. The one thing that I keep coming back to is why is it the government's business to tell us one way or the other? I said that if you take care of yourself, I don't see why you should be punished. I've seen articles that say red meat is the worst thing for you. Eventually, is there going to be a tax on red meat? It just seems I worry where it could go if it starts with just taxing sweet beverages because they're bad for you. Why not let people drink what they want?
So it's the slippery slope argument. So now it starts with sugar-sweet beverages and it goes to everything.
I suppose there's a slippery slope, and also just I don't want to pay more if I want to have a Coke every once in a while. I don't see why I pay more for it. And I saw you said the vinegar cost and whatnot, but then why not try and remove the government paying for those things instead of taxing other people for just what they want to do?
Well, I think it's a fairly simplistic solution. I mean, obviously, you know, the government plays a role in quite a bit of what we do. And one of the arguments that I tried to lay out in demonstrating that there are criteria to determine when it's warranted to have the government or some other agency intervene. And so I emphasize the fact that, you know, it's only adjusting the price. It's not restricting any availability on the market. So you're certainly free to choose whatever beverages you drink. It just adjusts the price that you pay. So I would underscore this idea that oftentimes people resist these new types of any kind of intervention or change, but I would generally guess that most of you feel comfortable with the idea that someone out there in the government is actually supporting the idea of cleaning the water that you might be drinking, that made your coffee or went into your water bottle, or inspected the meat that might be in there to make sure it was free from parasites. People generally feel comfortable with other kind of public health government regulation and intervention, but it's more invisible to us. So whenever there are new considerations for taxes or other intervention, I think people get nervous and feel uncomfortable about it. But there's plenty of public health regulation and intervention that we're happy to see take place, so that we're not eating, you know, parasite-ridden meats or drinking tainted water.
Other questions? Yes? Yeah, Chief Ryan.
Building on kind of what he said, I was wondering what you thought of both that's probably going to have to do with stairs more on San Francisco that will essentially ban animals.
I heard about that. You know, I will say that it's an interesting concept. It was the first I'd heard of it. I don't know that we have any empirical evidence to suggest that, you know, it goes back to this idea of marketing, which we talked about earlier, that it's promoting, that kids are ordering Happy Meals because they want the prize, or the kid-oriented marketing. I don't know that there's sufficient evidence to really warrant that. I mean, certainly their city council can choose to do, and San Francisco is often, you know, taking on a lead role and engaging these kinds of behaviors. I don't know that there's any, going back to Gosson's criteria, I don't know that we have any evidence that intervention would work. So I don't think it's a strategy that until we know that there's going to be any association and change behavior, I don't think it's worthwhile.
And anecdotally, my parents never bought me a Happy Meal in my life. And that might have deprived me in some ways, but it really hasn't helped my weight.
Other questions? Yes?
There's an argument for price that you pay for something like that, but it's not actually reflecting the price like for like energy resources.
Can you speak up? I'm sorry.
There's an argument to be made for the price that we pay for certain things like fast food doesn't actually reflect the reality of the price we pay in terms of energy resources and resources. Would an argument such as that ever happen to affect something like a false advertising?
If the argument is that there are externalities from producing certain types of things, then tax the externalities. You know, we have a carbon tax if you think that producing meat is somehow environmentally worse than shipping vegetables across the country. You do that through the price signal, and you know that's a larger, I think, social issue than something that can be handled through litigation.
Mr. Klein, do you have anything to add to that?
No, I mean, it's certainly an interesting concept. Just from the behavioral perspective, I mean, I think that, although you mentioned the menu labeling and that there was a response to menu labeling where people were increasing their total calorie consumption, I've actually seen some evidence that people will modify their consumption based on menu labeling. I don't know that we know too much about how people will, you know, interpret and change their behavior in response to something like what's the potential broader consequences of these actions. I don't know that we have the behavioral data to suggest that people would respond in any direction that I can hypothesize.
I mean, people do respond, and you know, corporations don't just thoughtlessly produce things. They produce things that they think people will want, and people say we want something different. They change in response to that.